Good morning, everyone, and thank you and welcome to this Community Health Summit. I'm David Schoberg, the president of the Partnership for a Healthy Community. We appreciate you being here today. We've worked to make this a meaningful and productive agenda, and hopefully an event that has positive results for all of us who live in and care about the Escambia and Santa Rosa counties. To get us started this morning, I'm going to start our day by introducing Mark Faulkner, the President and Chief Executive Officer of Baptist Healthcare and the recipient of the PACE Business Leader of the Year Award, to kick off our program. Thank you.
Thank you, David, and good morning. Wow, what a turnout. I have to admit, I was a little bit nervous when we started planning for this day, not sure what kind of turnout we might have. I'm here because I love this community. I'm a product of this community. I grew up in this community, and it looks like we have a room full of folks that share in that same mindset. And I'm here, and hopefully you're here today to talk about how we can continue to improve the quality of life for our community. When we talk about quality of life, it's sort of represented in really three legs of a stool. One is the economy of the community. You know, we look at unemployment, look at median income, poverty level, those kinds of things. We look at education, the strength of our schools and higher education. But the third leg of that stool perhaps goes a little overlooked, and that is the health status of our community. We talk frequently about economic indicators. We're constantly bombarded with information about unemployment. We talk a lot about the success of our schools, but we really don't talk a lot about healthcare and the health status of our community. That's what today's about. And today's about really understanding not only how this impacts us, how it impacts me, but also how we can impact it. And so again, I appreciate you spending this day with us. I look forward to a very productive day, a very engaging day, and hopefully we'll all leave here with a better understanding of our situation, but also some to-dos on how we can impact this. Let me start with kind of a refresh, kind of a reset of information. Hopefully you all recall that we conducted a health needs assessment recently. In fact, this has been going on for about 18 years. Baptist Healthcare and Sacred Heart and Partnership for Healthy Communities periodically do a health needs assessment dating back to 1995. So I'm going to do a refresh of the data that was shared back in December. And we've gotten some more recent data from the Robert Wood Johnson Foundation. So just kind of go with an overview of how we're doing as a community. And I'll start with the list of favorable results. And when I'm talking about the community, I'm talking about Escambia and Santa Rosa County. Some good news. We compare favorably in some rates for some types of cancer and total cancer cases. Our utilization for hospital inpatient stays compares favorably to other communities similarly situated in the state of Florida. And we have lower rates of liver disease. Now, I'll get to the unfavorable, because that's a pretty short list. And now we have about a dozen slides of unfavorable, not a dozen slides, but we have a few of unfavorable results. Again, comparison to peer counties in the state of Florida. So higher death rates for Alzheimer's, cerebrovascular disease, chronic respiratory disease, diabetes, heart disease, pneumonia, influenza, stroke, and lung cancer. Higher incidence of breast cancer. Higher utilization of our emergency departments, mainly for primary care. Higher rates for number of smokers, adults with asthma, adults with diabetes. Higher rates of teen births and low birth weight. Higher rates for injuries and violence and crimes in Escambia County. Higher rates for sexually transmitted disease. So, those are all, again, very important metrics, and all of which we compare unfavorably to the state of Florida. Now, this is a perspective slide here to put some context to this. First of all, the United States, among the 17 developed nations, ranks toward the very bottom of that list in terms of overall health status and health outcomes. So the U.S. doesn't compare favorably internationally. Florida ranks at the bottom third among the states in the United States. Escambia and Santa Rosa County, we have 230 health indicators that don't compare favorably to peer counties in the state of Florida, and this is cause for concern. And then last, Escambia County ranks 55th among the 67 counties in the state in overall health status, and among the 17 MSAs, the Santa Rosa and Escambia County MSA ranks at the very bottom. Now that's our wake-up call. If we were to say the same thing for education, for economic development, that's how we compared in the state, that would be cause for alarm. And certainly it's cause for alarm with respect to health status. So as we're defining the community today, we're talking about the two-county MSA. Now why does this matter? How's it all connected? Well, that's part of the day, understanding how education, how economics, and how health all are intertwined together, and how a healthy community leads to a healthy economy. And again, what's in it for us? What's in it for me? How does this impact me, and how can I impact it? That's part of today. So a few things here with respect to the data. We've been doing this for 18 years, but as a community, these are data that we cannot ignore any longer. We've sort of known that we've been in this situation. We haven't had any significant movement over the last 18 years in these metrics, and now it's time to figure out how we as a community can impact this. Because represented among us today are folks from government, folks from large employers, small employers, providers, area not-for-profits. We all have a stake in this, and the goal is today to understand what our stake is and how we can impact this. So here's a description of the day. We're going to start with Rick Harper. He's going to describe the connectedness between health status and the quality of life and economic impact. We're going to talk about how it takes an entire community to affect this, not just a hospital, not just a doctor's office. We're going to begin to break this down, all these data, into bite-sized pieces. Dr. Turner and Dr. Vinci will take us through that discussion. We'll have a panel of folks from employers who have talked about their experience and what's worked for them and what hadn't worked for them. And then we'll have a wrap-up. Susan Davis from Sacred and I will have a wrap-up of the morning. And we'll kind of launch into the second half. We'll break for lunch. We've got bacon cheeseburgers and milkshakes for everybody. And no, I'm just kidding. We'll break for lunch, and then we're going to put you to work. We're going to separate by employer groups, provider groups, and begin to break this down a little bit more. These groups will be facilitated, but we'll be looking for your input and how we can impact this important endeavor. So again, key themes. It's impacting us already. We're all bearing the cost of this. We're all feeling the impact of this. A healthy community equals a healthy economy, and it's going to take all of us, employers, providers, government, to create solutions around this. And it starts with us. So again, I appreciate you being here. I appreciate your engagement, and I'm looking forward to